to support national and global efforts to ensure that Malagasy people have a long and healthy lives. And to doing that, we are strengthening basic primary health care, knowledge and practices in rural areas. So volunteers are working with implementing partners who are the Malagasy health professionals, could be a doctor, could be a nurse or a midwife, or maybe what we call community health workers or community health volunteers and mothers. And health volunteers facilitate health education at the community level and doing community outreach. Volunteers deliver messages to men, women, caregivers, parents, and using behavior change for communication, which is using evidence-based methodology. And the areas of interventions are on maternal and child health, nutrition, WASH, malaria prevention and control. So, volunteers work in what we call communes, where there is a health clinic, and in that health clinic there is either a doctor or a nurse, or a doctor and a nurse. So the doctor and the nurse is your supervisor. The counterparts or the person who are working daily with you, we do not assign you the counterparts, but you choose your counterparts according to the projects you are working with. Let's say you are working on water and sanitation, then you may want to work with the water and sanitation responsible in that community. If you want to do maternal and child health, then you may want to work with the community health workers who are taking care of mothers and children in the villages. Approximately those communes or communities have around 2,000 population, but it depends on the region. And villages do not have electricity nor running water. Communication is by cell phone, and internet is very limited. I think that's what I prepared briefly for you, and I'm going to answer to your questions now. Question, guys?
There's 2 people that are typing right now.
The question about water or electricity, there are very few sites with electricity, but none of the sites have running water. You have to go fetch water from a public tap or a public well or from a shared water source.
How far are they, Tovu? Like, can you kind of give us a distance?
It depends. For some, the water is like 10 meters from the public tap is 10 meters from the house. For some, it could be like 50 meters. And with that, volunteers buy water by buckets from someone who is fetching water for the entire village.
Thank you, Tovu.
For working with doctors and nurses, Nothing should be prepared, but because only 20% of your time will be spent at the local health clinic. At the local health clinic, and 80% will be spent in the villages around, working and supporting community health workers. So you don't need to prepare for anything. Distance from the health center and your homes, in general, they are not very far. They are close around the health center. I would say the farthest is 200 meters from the house. The health center is 200 meters from the house. Question about working with mothers and children. That's 50% of your time. Because the main goal of the project is maternal and child health. So 50% of your time is to work with mothers and children, especially doing an activity called care group. All health volunteers should have their own care group. How flexible is Peace Corps with starting secondary projects? Volunteers can start secondary projects after IST or MSc.
And IST stands for Tovu?
IST is in-service training, which is your training after 3 months at site. So we do PST, pre-service training, then you go to site for 3 months, then after 3 months, you come back and we do 2 weeks of more in-depth technical training for everyone.
There's one question from Jessica. She's asking about how will banks work? Will they get an ATM card to access a bank account? Or do they have to fill out slips to take money out? Can you speak on that a little bit, Tovu?
Okay. On week 2 of training, you will open your bank account. Everyone will open their bank account, and by the time you will be installed at your site, you will have your ATM card plus the checkbook if you want.
And the money gets deposited, correct, into their bank accounts?
Exactly. Peace Corps will deposit your money into your bank account after you swear in. But before swearing in, Peace Corps will provide you with
like an allowance.
Walk around allowance money. Yes. How is the food? The staple food here in Madagascar is rice. So every time there is a mountain of rice on a dish, on a plate, plus what we call a side dish. And the side dish can be meat with beans or vegetables or anything you eat with rice. Another question about phones. It would be good to bring an unlocked phone, unlocked iPhone, But during PST, Peace Corps will provide you with a SIM card and a phone. That will be like deducted from your money, but yes, Peace Corps will buy standard phone for all volunteers and provide with SIM card to each volunteer. If you want to use your iPhone, it should be like unlocked from the US. I don't know, Naj, if you can answer to the question about transferring money.
So Jessica, you're asking if you should transfer money from your U.S. bank account. Is it that recommended to avoid ATM charges, or should that be separate? No, you do not have to transfer money to your account that you'll have in Madagascar. The purpose of your monthly allowance is that you're supposed to live at the level of your community members, and it's sufficient enough where you can it's sufficient enough where you can buy some extra things, but not where you're where you're buying or taking trips, or just buying things that are not on the level of which your community members are on. But it is enough to at least keep you healthy, and you can splurge from time to time. But in terms of having access to your U.S. bank account, some volunteers do bring their debit cards or credit cards with them, so that during the time that they're there and you're in country, you can travel if need be. But you don't need to like link it up or transfer money into that account. Peace Corps provides you with an allowance every month so that you could live comfortably.
Thank you, Naj.
No problem.
There is a question about what are the best methods volunteers use to deal with burnout and stay motivated. Well, you will have vacation time, and Madagascar is a very big country where you can go and explore the diverse biodiversity and our island. That's one, but also volunteers can do projects together, what we call site exchange. So you go to another volunteer site and do activities together there, learn from their activities, and bring it back to your site after. How much cash should we bring? I don't have the answer to that question. What will be the main type of communication and person we will contact for work issue or question? For work issue or question, you contact me, or you contact Mamina, who is here, the health programming and training assistant, or you can contact the volunteer support liaison here at the Peace Corps office. We are a team, and we work together to try to accommodate you in Madagascar.
Tovu, can you walk them through basically what their PST may look like? And then also maybe what a day in the life of a health volunteer looks like. Maybe one project that a health volunteer has done.
Mm-hmm. So PSTs, you arrive on February 8th. Then you stay you go directly from the airport to the training center, which is located 70 kilometers away from the capital. Then you stay in our beautiful training center for 3 days, doing orientation, learning some language, culture, doing some medical sessions, cross-culture sessions, and then Saturday afternoon you go to your homestay. And then we do training in the villages. There will be a learning center in the middle of the village where we gather for sessions together. The health people will have our own learning center, and we do sessions every day, mostly in the morning language, and in the afternoon cross-culture or technical, until week 5. Then on week 5, someone from your site will come for a 3-day workshop. The homestay that's going to host you at your permanent site. Then we will do a homestay workshop for 3 days. Then after that, you and your homestay will go to your site, and you stay there in the homestay for 2 weeks. You don't stay in your in your house yet, but with the homestay. And then after 2 weeks, you come back to training center again by yourself. And we do a lot of technical trainings. And during the week 8, 9, 10, and 11, you will be expected to do 2 practicums. One is with your peers on basic nutrition, and the second one is with people in the village on basic wash. And then you swear in hopefully in April 28th, and then we start to install you. Peace Corps staff will go and install you at your permanent site after that, and help you buy things and install you and secure your house and do the protocol visits and all of that stuff. So a day of a life of a volunteer during the first month at site is to learn about the community. So to explore the community. Where is the market? When is the market? What's available? Where is my favorite coffee seller? Where do you usually eat breakfast or drink coffee? People wake up very early here in Madagascar with the first rooster in the morning.
Around what time? So, like 5:30, right, Tovu?
Yeah, around 5. And then you go prepare or eat breakfast and chit chat with your villagers, with your friends around. And then at around 9, you go work. Let's say you have a program at the local clinic. The mothers are already waiting for the doctors to start the vaccine day. And then you do health education on vaccine while mothers are waiting for the vaccines to start. And then you help the clinic people during the vaccine time to try to organize things, because it's a lot of people and lots of documents to fill out, and it takes time. It may take until like 2 or 3 in the afternoon to finish all of the vaccines for the day. And then after that, you go eat lunch and you relax in your house, and you go to see some friends in the afternoon, and then back to your house for the evening and eat dinner and sleep.
Great, thank you, Tovu. One thing I would like to definitely highlight within the first month, your integration is key, and definitely during pre-service training, they'll walk you through how to do that. But you definitely, in terms of waking up in the morning and going to get coffee and visiting your friends, it's very part of your it's part of you being successful as a volunteer in terms of how well you integrate into the community, and your interactions and the relationships that you develop will actually really make you a successful volunteer. So
Thank you.
you're welcome, Toby. I think we have a couple questions here on
Yes.
the side.
Okay. So furniture at site, it depends on if you are replacing a site, then the former volunteer may leave some furniture in the house. But if they choose to give out everything, then you have nothing in the house. But if you are assigned to a brand new site, then nothing is in the house. You have to buy everything: bed, chairs, tables, stoves, pots, everything. Dana's question: will you get experience with any work-specific equipment? So that PST either be exposed to that or promises. Yes, yes. During PST, you will be exposed to mainly wash and basic nutrition materials. And then at IST, when we come back after 3 months, we will teach you and share you with more in-depth technical training on different topics. Technical trainings are taught in English, but the practicums at the end of PST are in Malagasy. Insurance coverage, I'm not very familiar with that. Maybe Naj can chime in for that.
Caroline, what are you referring to in terms of insurance? Are you referring to health insurance? Health insurance. Okay, so the day that you sign in and you come into staging, and you sign in as a trainee, we as Peace Corps are responsible for your health care at that point. So anything that happens after that, yes, Peace Corps will provide health care to you.
Naj,
Yeah.
Mariana wants me to talk about budgeting.
Okay.
So, no, sorry. There was a question that was previously made. Hi, everybody. I interviewed you for this program. There's a question that was made about how you are paid. And I wanted to bring up that there are two other elements that go into how much you are paid. There is a survey that is conducted to be sure that, hey, the amount that's being deposited is indeed covering all the incidentals from clothing to food to transportation for when you have to go collect your stipend. If you budget accurately, you have more than enough money to take vacation as well, which ends up timing into how you remotivate yourself and you recharge, because you have 2 days of vacation a month that you can take. So the importance of budgeting is going to be key. And you can easily blow all that money if all you do is spend a lot of money on data, because internet data is expensive. But that was my only other point for two. I was like, dude, talk about budgeting.
Thank you, Mariana.
Thank you. Question about French versus Malagasy. I would say 99% of time Malagasy is used, and French is only used mainly for numbers and money. In sites where we have health PCVs. In the north of Madagascar, they use, let's say, 60% of Malagasy and 40% of French. But we don't have health volunteers in the north of Madagascar. And that's a good segue to Tana's question. Health volunteers are posted in the East Coast, the Central Highlands, and the Southeast.
Tovu, how far apart will volunteers be? Are they put in clusters in terms of like all health volunteers are together, or will there be other volunteers from other sectors perhaps?
We cluster the health volunteers first. So for sure there is no like health volunteer isolated, but there is always some health volunteers around one health volunteer. But also we try to cluster with the other sector, which are agriculture and education. So around you, there is always one health volunteer or an ag volunteer or an education volunteer. And we have sites where there are two volunteers, one health and ag or one health and education.
Great, thank you. Do we have any other question? That's a good question.
Question about Addison's question. Yes, there are different cultural norms in different regions, and we will address them during PST because I cannot just tell them here now because they are so different per region. But for sure, we will address cultural norms during PST. How would we charge our phones if we have no electricity? Then towards the end of PST, we are introducing you to some solar panel sellers, cheap solar panels that can charge your phone or computer or iPad or iPod or anything. But some volunteers bring their solar panel from the States too. And there is always, in a village, there is always someone who has a generator that you can pay a very small amount of money to charge your phone. Yes. Favorite things Malagasy do in the free time. We play soccer or we do other sports like basketball, but soccer is the common game we do during free time. Like every Saturday or Sunday afternoon, you may see people gathering in a village watching soccer game. But where there is water, people go swimming or fishing or doing other things. Dana, will we be provided with a Malagasy dictionary or should we bring one for our own use from day to day? Peace Corps will provide you with a dictionary. They might be challenging because the words are not the words that we usually use. So if you have your own, like you think like the best dictionary you could find, then why not bring that? Because I know the dictionaries, there are some cheap ones and some expensive ones. And yeah, if you have a good one, then please bring. But Peace Corps will give you one. The drought in Madagascar. The drought is in the south, very deep south of Madagascar. We don't have health volunteers there, but we have ag and education volunteers there. Do health volunteers ever partner with? Yeah, organization. In each site, there is at least one organization working there. So volunteers should partner with the organization. One of the organizations is, for example, I don't know if you are familiar with PSI, Population Services International. They work everywhere in Madagascar, and they partner well with PCVs, health PCVs. Grassroots Soccer just came to Madagascar in November to train our volunteers, but they are not really based here. They are based in South Africa. They don't have activities in Madagascar except with health volunteers, but there are different organizations that volunteers are partnering with, especially USAID-funded programs. There are different USAID-funded health programs in Madagascar, and health volunteers are working together with all of those programs. Do we get the weekends off? If we want to take vacation, can we take off and use the vacation days for the vacation? Weekends are not vacation. Weekends count for vacation days.
But Tova, do they get days for banking, going to their banking town?
Yes, each volunteer has 2 nights per month to do banking, and can get 2 nights per month for what we call rest and relax. When you feel burned out and you want to speak English with your friends, then you can visit other volunteers for 2 nights per month. But they cannot be taken back to back.
The banking days and the rest days can't be taken back to back,
Yes,
correct?
yes. No, no,
Okay.
no.
All right. And then when we talk about banking town, your banking town is where literally you go and get go and get money. There's an ATM in that town that you can retrieve money from. Most of you will be 30 minutes, 20 minutes, give or take, from your banking town. And the village that you're in will not have an ATM. And so when we say banking town, that's what we refer to as you will have to you have to travel about 20 minutes, maybe 30 minutes to your banking town in order to retrieve money. And in your banking town, it's usually a bigger, if you want to say, it's a bigger town than obviously your village. So there's going to be an opportunity for you to buy, your favorite things, or just more items for your house, or eat some better good food if you like.
Exactly. Thank you. Mm, 20 minutes in a taxi, Bruce.
Yeah. Some volunteers bike, correct, Tovu?
Yes, yes.
Mm-hmm.
Some can bike, but you cannot walk.
Yeah.
Either you bike or you take a taxi, Bruce, to the bank in town. Yes, you will get a bike, a helmet, and bike tools and things to repair your bike.
Any other question?
I would say about the population, I would say about 2,000 in the main village where you will live, but the total for the entire commune would go until like 20,000. Dexter, do we know what type of bike? You will get, what's that, Trek bike. It's a very good bike.
Dexter, you don't have to bring any tools. They will provide that in country, and will teach you on basic methods on how to, repair a tire and maybe check your brakes.
Yes, thank you. Addison's question about the language. Yes, because Malagasy language is very far from English, and no one speaks English. But the Malagasy language is very easy to learn, and you will master it very quickly, and with the help of our language and cross-culture facilitators. If we would like to mail things, should we bring? You can take all of the mailing things from here. I think to start with, we provide you with some stamps to send in postcards or light envelope. And then later you will need to buy your own stamps. There is a post office at the training center's town. I see Mariana typing something. Don't know.
Oh, I was just going to say, you can't really use U.S. stamps for Madagascar post office. I've seen some volunteers take U.S. stamps because, let's say your friend is traveling to the States and you want to give them a couple of envelopes and they're going to mail that within the States. That's U.S. stamps are made for U.S. mail, but in Madagascar, you would have to purchase a Malagasy stamp.
Cassidy's question, if our families want to send us packages. Question about the address. You will be instructed about the address when you arrive in Madagascar. When you arrive, we will introduce you to everything, mailing, addresses to use, all of that stuff.
Also, in the next week, you will also receive a document called the Bridge to PST that also will include the mailing address. Say, for instance, your friends or family want to send you something right now, so that by the time not right now, but maybe in the coming weeks, they want to send you something for a while you're in PST. They can mail you. They can mail you something. You'll have the address, so they can mail it to you. And then, like Tovu said, you will also receive all that information once you get in country.
This address is good, Dexter. This is our Peace Corps office address.
Correct. And they get a different, and then once they move to site, then they set up a PO box. Correct. And then once you get to site, then you'll have a different address that all of your packages can go to. You'll have to go there to the post office and pick them up. Sometimes you have to pay a slight fee in order to get the package. Correct, Tovu?
Yes, that's correct.
Okay.
Sometimes PCVs share a PO box at the bank in town.
Great.
There is a question about how happy Malagasy people are with our intervention. I'm going to ask Mariana to answer this.
Oh, Mariana actually just left. She has to go for an interview.
Uh-huh.
But I guess the question more so is asking, are the Malagasy people very receptive to the volunteers being there and creating awareness about maternal child health and things like the interventions that the volunteers do? Are the Malagasy people receptive, or does it take some time before they really adapt, or you see a behavior change?
Malagasy people are very, very receptive to PCVs, to health PCVs. I'm not sure about the other programs or the other people intervening in Madagascar, but I know about volunteers. They really, really like working with health PCVs, especially when the volunteers are really integrated and taking well the language. Behavior change is difficult. It's something very difficult. And volunteers sometimes do not see the result of their work by the time they are closing their service. But when we go visit the site, then we always hear what the volunteer did, like such volunteer did this to us here. We really love that volunteer. We really like what they taught us. They taught us this. So, yes, health volunteers, Peace Corps volunteers are well received in Madagascar.
You may have some challenges because you may be the first, perhaps maybe American in that village, and so it probably may take some time for you to first kind of like get any projects going, and that's why integration is such a key part in the first 3 months while you're at site, is building those relationships and establishing those friendships, so that when you start trying to implement your projects, they will be a little bit more receptive. But it does take time. I was a teacher in Kenya, and a lot of the things that I wanted to do, I understood. I had a hard time really trying to do because I didn't have the relationships at first. But as time goes on and you learn the language and you integrate, you'll be able to really kind of connect and really see your projects grow. But I've found that in most cases that they may be hesitant in the beginning, but as you establish those relationships, they kind of open up and kind of want to know and understand what you're doing.
Thank you, Nach.
Mm-hmm.
Question about replacing existing volunteers. Most of you will be replacing existing volunteers. 19 out of 27 or something are replacing volunteers. question from Dana. Is just a notebook sufficient? I would say it depends on your learning style. Some volunteers always bring their notebook, their dictionary, their other handbook, and read through it when there is like a break or things like that. But it depends on your learning style. Once you arrive in Madagascar, we will provide you with notebooks, pens, dictionary, and other things you might need during PST.
One thing I would like to add is I didn't see a question about either laptops, and it came in the other conference call that we had yesterday. We do like to highly suggest that you bring a laptop to service during your 2 years because there is quarterly reports that you do need to complete and submit to your supervisor, and it is a little bit easier to have a laptop if at site in order to complete them. Your banking town may have like an internet cafe that you can go to in order to complete these reports, or you may have the chance to go to maybe a regional office to complete these reports. But I have found that most volunteers really do suggest that you should bring a laptop in order to complete these reports and create like other materials that you may need at site. Okay, so if we don't have any other question, I would like to end the call here right now. I want to first thank everyone who joined the call. Thank you so much for your great, wonderful questions, and I know a lot of you are really excited for your departure. Just as a reminder, your staging is in Philadelphia. You received the staging instructions maybe a couple of days ago, and it's February 4th. If you do have any questions about preparations, please feel free to contact me. I know some of you haven't received legal clearance, and so I'm watching that, and we'll update you as so. But again, thank you so much for joining the call this morning. It has been recorded, and I will send it out in the next couple of days. Tovu, thank you so much for joining the call and giving us a really great overview of what the health project looks like. Any last words from you?
Thank you for the
Thank you very much, everyone, and can't wait to see you here in Madagascar. Really eager to welcome you to Tana and working with you for at least 2 years.
Great. All right. Thank you, everyone. I hope you guys have a great day. You all have a great day.
Thank you.
Bye.
Bye.
Okay.